We're here in the emergency department with Dr. Ken Herman, who is the chair of the Department of Emergency Medicine at JFK. Doctor, good to see you.
Nice to be here. Thank you, Steve.
Now, I took a tour about a month ago, and I was really blown away by what I saw here. There's a lot of technology that's a big part of the emergency department. It moves people along in a certain way. But the first question I have to ask you is, people are waiting in an emergency room, and they don't know why they're being called or not being called. What's the process here at JFK?
Well, the process is something called triage. Triage actually started way back when on a military model to decide who really needs the access to care the quickest. It's not necessarily first come, first serve. We use something called an emergency severity index, which categorizes patients into 5 different triage categories to determine not only who needs the care the fastest, but who is going to require the greatest number of resources, also designating in what area of the emergency department they should be placed and how quick that should happen.
The other thing is, when I was here, I got to see some of the technology. I saw this big board. I saw all this information about who was where, what was going on with them. That's relatively new, Dr. Herman. Talk to us about the role of technology here in the emergency department.
Well, the whole idea of technology is to manage all the information which pertains to patient care and patient management and get it to the providers, the doctors and nurses, who need to in turn apply all that information to the patient to obtain the best outcome of patient care possible. The best way to do that is to be able to locate the patient as quickly as possible and to be able to know who you need to speak with to get that information to the proper people to implement the information and apply it to the patient so that the patient can be treated with proper medication.
It's made a big difference.
It's made a huge difference. It's cut our time of patient care to a fraction of what it was. It's expedited point A to point B kind of management such that we can really not only move the patient through the system quicker, but we have better outcomes. Patients who come here are being treated quicker, and as a result, they're getting better, faster.
Dr. Herman, it's been said that the emergency department, the emergency room, really is in a lot of ways the front door, if you will, to a hospital. What does that mean, and what's the front door like here at JFK?
Well, the front door, first of all, is always open 24 hours a day, as you know. We intend to open our arms to the community so that they know that they can come here at any time if they feel that they may have an emergency. That not only gives a community a sense of well-being, a sense of assurance that they can go someplace if they are in need of emergency medical care, but it also maintains at a minimal or greater than minimal baseline the health and well-being of the community. If they have easy and ready access to emergency services, then it's an individual's health really can deteriorate to just a minimal level at the very worst, and therefore contribute to the overall health and well-being of the community.
For those of us who have kids, we're particularly concerned about pediatric issues. Right now, when I went on the tour, I saw an area, a pretty new area, where kids are being treated. Talk to us about the pediatric wing here in the emergency department and why it's so special.
Yeah, the pediatric emergency department is staffed by specialized nurses and physicians trained in pediatric emergency medicine. It has a different, as soon as you walk into the pediatric emergency department, it has a totally different physical feel, a totally different psychological feel. You're treating children and you're treating their parents. That's the difference in a pediatric emergency department as opposed to an adult emergency department. The parents, the psychological well-being of the parents and the children contribute to the physical well-being of the kids as well. Not to mention the fact that they certainly have specialized conditions, and it does require some special expertise in those fields to, again, make the success of the pediatric emergency department.
It's another way that JFK Medical Center stands out.
It stands out there. The medical center and its administration is very dedicated to the well-being of pediatric patients and is really looking to further and evolve pediatric care within this medical center.